I also wanted to bring up pain after the surgery. Um, in my experience, it's not bad, but I will say it's a little worse than just the bicep rupturing. Um, the first time when I did this one 2 years ago, um, when I left the doctor's office, they had given me some pain medication, like as I was leaving or right when I got out of surgery. I don't know, but I had some pain meds in me as I was leaving. And for that surgery, was a little later in the day. I took one pain pill at night because I, wasn't sure how this was going to feel. I was still had some medication. I took one at night, and by the next morning, yeah, it hurt, but I didn't take any more pain medication. So I took one pain pill that first time for the last surgery 2 years ago. For this one, which was 3 days ago, when I left the doctor's office, it was early in the morning, early-ish, like it was like probably like noon. I had the surgery. I was leaving by noon. Um, they didn't give me meds as I left. I didn't have any pain medication in me. At least that's what they told me. Um, so it did. I was in some pain. I got home. We had the pain meds. We picked them up already. Um, I popped one when I got home. Later that day, in the evening, I popped another one because I was having some pain, and then I popped one in the morning. And after that, I was fine. So I did for this one. I did pop 3 pain pills, um, but then it's fine. It didn't hurt anymore. I prefer not to take the pain medication because it kind of lets me know if I do something I shouldn't do, like ow, that hurts. Where sometimes, you're feeling good, you kind of forget. Next thing you know, I'm holding like cereal and I'm eating a bowl in my hand, and I shouldn't be doing that. Or I end up cleaning the closet or the garage or moving something in the yard with my left hand, but anytime you're doing this stuff, you are tensing and flexing other parts of your body. So, although I have been doing stuff, I try to do as little as possible without affecting this arm. So, for the pain, it's really, I'll say, a little bit worse, mostly because obviously they've cut you, they've drilled through the bone, they pulled stuff apart, so the pain is probably a little worse than just rupturing a tendon, but it's not that big a deal. It just drags on, obviously, for a few weeks until this heals. I am taking, though, they did also give me anti-inflammatory, which I do take every day, and that reduces pain a little bit. It also reduces swelling. It helps with it's arthritis and stiffness of the joints, and it's an anti-inflammatory. So that's something I am taking every day, just to help with inflammation and reduce swelling and stuff. And that I would think everyone should take. I think it's called like meloxicam or something like that. Meloxicam. I think I'm taking like 15 milligrams, and it's like you take it once a day, and supposedly it's like a slow release, or it stays in your system for roughly 24 hours. I don't know. But that's the only thing I'm taking. Okay, this has gone on way too long, but there's one more thing I wanted to bring up that helped me, I think, with the swelling and some of the pain, which I didn't do the first time because I felt like I wasn't in quite as much pain, or I didn't have maybe as much swelling the first time, or maybe I just didn't notice it, was ice. With this soft cast here, you really can't get ice on the wound, because this thing is wrapped in here, like there's no icing it. Like I have to, like, I don't know, put my arm in an ice chest to probably make it get through this thing. So what I did, which actually I felt worked really good, is I would hold a ice pack in my hand, or I had two ice packs sandwiching my hand, and I also had an ice pack in the shirt. I was wearing a button-up shirt the first few days, because it was just easier. Just a big button-up shirt that I was just putting over my arm and sling, and I would have an ice pack here on the shoulder, just, or like literally some peas or a bag of vegetables. I would just switch out bags of vegetables out of the freezer and just put them on and around my shoulder and even my armpit a little bit. So having the ice there and having an ice pack in my hand, or sandwiching my hand between two ice packs, I felt really helped with the swelling. And because I did have some swelling, that first day, this thing felt tight. My arm felt really, I thought it was too tight. I thought, like, this thing's too tight, but I think it was just the fact that I was having some swelling. It feels fine now. But having that ice pack here and here, I think helped kind of regulate, maybe cooled the blood, hopefully, as it went through my arm. And I really think that helped with the swelling and the pain as well. So I did that for the first 2 days, like a lot, on and off a lot. So give that a try. Hopefully that'll help.